All right, so we're going to take our curing light and we're going to shine our blue light on that tooth. Don't look at the blue light. I know it's pretty, but don't look at it. And this is usually 20 seconds. Now we're going to take our cotton rolls out. We're going to take our articulating paper and our patient is going to bite down on it and grind around a little bit, and no high spots. Okay, so now we've done coronal polishing and we've put a sealant down. Now we're going to do our varnish. Before we do our varnish, let's floss. Patients love when we floss them. So what you're going to do is wrap the floss around your fingers, just like this, and you're going to floss all the way in the back with a C motion. Put it down in between interproximally. Make sure that you get all the way on the distal and on the mesial of every tooth, this tooth included. And if you were doing a full mouth cleaning or polishing, you would do this on every tooth. Make sure it's like a little C on it and you can go in the other direction. And you want to make sure it's as close to the gum line as you can. Never just push it in because that hurts the gum tissue. So you want to be kind of gentle. Sometimes the contacts are very tight, and so it might be a little harder to get it in. If they are tight, if you just seesaw back and forth, you'll be able to get it in and then pull it out. All right, now we're going to do our varnish. And our varnish comes in a little kit like this. This happens to be from Darby. It has in it a brush and the varnish. This is enough varnish to do the entire mouth. What you're going to do is just bend the brush, put a little bit of varnish on the brush. You're going to have the patient open, and you're going to put it on all the surfaces. Buccal, lingual, on the distal if you can get it on there. And you're just going to continue through the whole mouth. There's plenty of varnish in this container for the whole mouth. And you will be surprised that you still have varnish left when you're done using this fluoride varnish for the entire mouth. And now when we're finished, we don't need to floss because we've already done that. I'll put my patient's cheeks back where they belong. You can give your patient a rinse if they need one. I'm just going to suction all the water out of here. And now I'm going to tell my patient the instructions. As far as the cleaning goes, no certain instructions. Clean and brush as normal. As far as the sealant goes, if it feels a little bit high, it will wear down after a couple days of chewing. And as far as the fluoride varnish, nothing hot for 24 hours to drink or eat, and nothing super crunchy. Chips, Doritos, popcorn, anything like that that would be super crunchy. Carrots. We want to make sure that the fluoride varnish stays on the teeth. And also, if you rub your tongue up there or put your finger in, you'll feel that the fluoride varnish is very sticky. That also will dissipate within the next 24 hours. But you can brush and floss as normal later on before you go to bed. And that's all we need to tell our patient. We did a coronal polishing, a sealant, and fluoride varnish all in the same visit.